to MCAS Miramar to complete the 14 days of quarantine. If the results test are positive, basically we will be following CDC and our local public health department for directions on the next steps. But I want to stress again, all of these patients are doing very well and they are stable. These are American citizens, and these persons have gone through a lot, and their families have gone through a lot during these past weeks. We want to welcome them here and make their life here as good as possible. The coronaviruses basically cause anything from the cold, the common cold that we have all had and we have all experienced, to more severe manifestations. But the manifestations of this particular infection are quite mild. I would want to remember that right now remind you that right now we're having a very bad flu season. As you may know, we have had more than 7,000 deaths due to the flu in this season alone in the US. And so our priority is also to care for patients in the community. And I will stop there. The risks, the measures the CDC is asking us to take are basically to control the spread of this disease. So it's not because we are afraid of this virus, it's just to control and to protect other people. Operations are continuing normally here, and we want to keep it that way. Thank you.
Thank you. I'm Dr. John Bradley from Rady Children's Hospital, and we have a beautiful 4-year-old girl and her father, both of whom are asymptomatic, but Dad has a cough. He's absolutely fine appearing, and he asked me to share with you that he's doing really well, but they're in isolation. And as I went into the room this morning, I put on the isolation gowns, not much more than you would do for influenza, I want you to know. And they're both just fine. And the results that Dr. Toriani was mentioning hopefully will come back soon, and we'll be able to get them out of the hospital. And I want to emphasize that we have really good isolation policies and special rooms that were all designed for Ebola, which is far worse than coronavirus. And so these patients are in isolation rooms. There's absolutely no risk to anybody else in the hospital, none of the patients, none of the healthcare workers. So we want to reassure everybody. And this is just a precaution, because following CDC policy, we just want to make sure that if there are any cases, they're isolated until they get over their flu-like illness, which is what we believe is the most common presentation, not something that's horrible. So if we can isolate them until they get over their infections and then they're no longer contagious, then they get to go back to regular daily life. So,
any questions?
Any questions?
First, can you just describe the difference between isolation and quarantine? They're in quarantine at Miramar. What's the difference between quarantine and isolation?
Do you want to?
Yes. Quarantine is where you just tell someone that you need to stay in your room, and they're not allowed out of the compound, which was set up by the CDC and HHS on Miramar Air Station. Isolation is what we do for a potentially contagious patient, adult or child, when they come to the hospital, so that when they're in a room, and we've got special negative pressure rooms where the air from the room goes out into the atmosphere and not recirculated anywhere else. But the isolation rooms are designed to protect healthcare workers that walk into the rooms. So we all have our protection, and it prevents us from getting infected. It prevents those contagious patients, if they're contagious, and we don't even know that these are, from getting out and infecting anybody else in the hospital.
Who's paying for their treatment?
Who's paying for their treatment? I don't have the
We're
question.
following instructions, and basically this is under federal law, and so
You can
there will be probably some dollars going towards this. We are just doing our job as doctors.
Yes, and then we'll.
You're going to have these 4 patients in complete isolation until Saturday when the results come back, or when do you expect them to be out?
As soon as the results return, we will be informed of these results, and then we will follow CDC and public health instructions.
It's just a precaution. Yes.
Here. So, are the father and daughter in isolation separately, or are they together?
Nope, they're in the same room.
That's the purpose.
The little girl is so bored. She's done with one coloring book already and is looking for more. Beautiful smile. She's perfectly well. So we don't want to separate out the dad and the child, and actually that's why they're over at our institution. Yeah. And if the dad were to get sick and his test was positive, we'd be sending him over to UCSD Medical Center.
Sorry, just to follow up to that, you mentioned that if dad was to get sick, he would be sent over here to UCSD Medical Center. Is there a possibility that in case of an emergency that he would have to get treated there, or at least?
Okay, getting briefed by the doctors at UC San Diego Health as well as Rady Children's right now on the 4 people who were being evaluated for coronavirus, and we can tell you that they are doing well right now. Both are fine, and what was great to hear is the isolation policies that they have in effect at the 2 hospitals, keeping everyone safe. So they planned for this. They've got great processes in place. So the big takeaway is the 4 patients doing well. They are all American citizens. And we're going to find out if they do have the coronavirus on Saturday. If they do have it, they will stay in isolation there at the hospitals and wait on the CDC for the next steps. If they do not have it, they will go back to finish the 14-day quarantine period at MCAS Miramar.
Yep, you said it all. As early as Saturday, that's when we're going to find out. As early as Saturday morning. Yeah, so if they don't have it, which is interesting that they still have to go back to the 14-day quarantine. That part is still unknown why. They're all in stable condition. The 4-year-old girl, as you heard the doctor there, John Bradley, say she's doing well. They're just bored.
She's bored, right?
Yeah, nobody at the hospital is affected in any way because they have these special rooms that are actually designed for Ebola. So they have this special air that circulates out, and it's designed to protect the healthcare workers and all of the other patients. So yeah, that was the latest update, and we'll of course continue to watch this story closely.
Of course, Ebola far worse than the coronavirus, so they've got the practices in place, and they are in isolation right now, and it looks like they're in good spirits. So that is some good news coming out of this news conference here, and there's still more questions and answers being.
No. Yeah, we're just observing them, and you know, like if they have cough that disturbs them, we will give them some cough syrup as we would give them, but really nothing.
And
yeah.
we know a little bit about this virus, so there are potentially antiviral medications that we would use if they got really, really sick, and we got investigational approval through the FDA. Yeah. We're not anywhere near that. They're fine. Yes.
Yes, that is actually, that's the super cold. It may be, it could be, yes. It is what manifested in Wuhan, and once again, in the situation of an outbreak, you always see the patients who are the sickest, right, who present to care. And that is what happened there, is that the patients who presented into care were sick, were very sick, but subsequently further cases had quite mild disease. And so when we look at the mortality, let's think of the worst case scenario. The mortality due to the flu, our seasonal flu, varies, but basically in the US in general is considered to be up to 2.5%. In patients who have, you know, diseases, underlying diseases, it can go up to even 10%. This coronavirus, the estimates of death from this coronavirus are less than 2% right now. So very low, and these are, once again, these are the first patients who came into care, so the ones who were sickest, who presented and had really bad symptoms.
So super cold is excellent, and if you're already in bad shape, then a super cold may just tip you over, and that's what they're seeing in Wuhan.
So when we see reports where maybe one of the first doctors in Wuhan has died from this, I don't hear people dying from the super cold. Are you surprised to hear that he died?
Very surprised.
Yes, we are very surprised, but what we also, this is why, this is one of the reasons that WHO declared it a public health emergency, right? They declared a public health emergency because they knew that more means could go to hospitals in countries with less means, right? And so more protective equipment could go. There are fundraisers right now going on in the world to get materials to these hospitals in China that are overburdened also by other diseases.
So we don't fully understand the virulence of this, and it seems like it's a super cold, but we haven't yet defined the spectrum, and there may be a lot of people who just get the sniffles and get over, in addition to those that we've identified that will die. So the CDC and the World Health Organization are looking at virulence and contagiousness, both.
You mentioned that these are American citizens, all of the four?
Yes.
Yeah.
Yes.
Yes.
That's the one point I wanted to make to you is that what we know is that no healthcare workers who have followed the precautions set by the WHO and the CDC have fallen ill. So we know that in that hospital there may not have been the proper PPE available to all of the providers. And so if you're taking care of a very, very sick patient who's intubated, your chances of getting exposed to secretions, if you don't have the proper equipment, are much higher.
Yeah, PPE are all those gowns and masks and gloves that we wear. Yes.
Just a little bit more detail on the two patients that are here. Are you able to tell us their ages and male, female?
I don't think I can divulge that.
If there's no cure for this coronavirus, how do you treat them if tested positive?
So first of all, as Dr. Bradley said, there are now some agents, some antiviral agents that are being studied and that appear to have some efficacy, but these are investigational agents, and so we will pursue, if we need to use them, we will pursue the proper channels to get to these agents that are experimental. But the normal, what we would do for the flu, without, if we didn't have effective antivirals, which we do for the flu, and so we would treat them symptomatically. We treat the cough, we treat the cold, we treat them with antipyretics if they need.
So we want to reassure you, this isn't the first coronavirus that's hopped from animals into people. So SARS was much worse, and there was a lot of work looking at antivirals for SARS. So there's some basic research that we can apply to this virus. So we're not starting from scratch. And believe me, if in the United States we begin to see this, and even if it continues in China, we'll be working with researchers in the FDA to find experimental medicines. So the fact that we have no medicines is actually not quite true.
Yes, and also companies, drug companies who have these investigational medicines are have already dispatched to Wuhan and are currently doing clinical trials.
Yes, sir.
I know there was a lot of people who were uneasy about these people when they arrived at MCAS Miramar, and then since they've been taken into local hospitals, people reaching out to me, commenting on social media saying, why are we moving them? They pose a threat. I mean, is there anything you can say to reassure people that there's no threat here, or is there?
There's no threat.
There's no threat.
So, yes, I want to
really no
reassure.
threat.
What we've got in our hospitals are these specialized isolation units that we all put together for Ebola that are sort of airtight, as it were. Miramar Air Station is a nice place to hold them, but they don't have all of the isolation and the physicians, all the specialists to take care of patients if they should get sick. So they're only moving them because we've got isolation and medical expertise, not because they're contagious or we're worried that something bad will happen, just a precaution.
So you say it's almost like a higher level of security here than it is at the base?
A higher level of
Well,
isolation. Isolation.
I think that at the base, they can't treat any patients. They can only quarantine patients, but from a military standpoint, they do not have the capacity to treat anyone for anything, basically.
And we believe it spreads with large droplets, just like influenza. So the guidelines for influenza are you need to be at least 3 to 6 feet away from someone before you can actually catch it. And those are the same metrics we're applying to the novel coronavirus. So it's not like if a bus with someone, drives past the hospital here, everyone will get infected. You have to be within 3 to 6 feet of an actively infected, coughing, sneezing person to actually catch the infection.
Why do you guys think there's so much hysteria around it?
Why?
Because it's novel and it's causing, a large outbreak, and it's spreading, and there's a lot of things we don't know. What I would like to say to people who are afraid is that for the past 6 weeks and until February 2nd, we have had many planes coming in with a large number of passengers, and a rare number of these may have been infected. We have not had any transmissions if this were a very infectious virus, that whole plane after 11 hours of flight would have come down with coronavirus, and that there is no evidence for that.
Are you getting test kits from CDC? They started sending
So
out yesterday.
yes,
week.
our public health department, Eric McDonald, Wilma Wooten, are pressing the CDC to allow us to get the kits.
Yeah.
They're hoping for an FDA approval for emergency use of these diagnostic kits as early as today, and once we get that authorization, then the CDC can send it out. And we're pushing. Your San Diego public health people are pushing.
Yeah.
Yes, sir.
Yeah, I was just going to say, you had mentioned that the 4 people had mild symptoms. What was it that brought them here? Was it a cough? Was it a fever? What exactly was it that you guys said, yeah, let's bring them over here and let's take a look?
Well, we didn't say. These patients were referred to us.
Sure.
So the criteria for them are much more, much wider than the criteria we would use, simply because they can't give any treatment. And so it's respiratory symptoms, cough, scratchy throat, something like that.
So-
yes.
No. And the dad was supposed to have a cough, and while I was in the room for 15, 20 minutes, he didn't cough once.
Yeah.
And his daughter is perfectly asymptomatic.
Yeah. And the same for ours.
Dr. Rady,
Yes.
I know that there's going to be parents obviously trying to bring their kids to Rady children.
Yes.
With the extreme concern, especially when you have babies, maybe even first-time moms that are going to be mortified.
Yes.
What do you say to them?
Don't worry. So nobody who comes to Rady Children's Hospital or UCSD needs to worry at all.
Yes.
There's no contagiousness. There's no possibility that even if these 2 people test positive for coronavirus, and the same is true at UCSD Medical Center, that will spread anywhere. So there's no risk to anyone coming to the hospital, the emergency rooms, anyone that gets hospitalized. One of the other families was asking me that last night, and I reassured them there's no risk for them getting coronavirus, even if the patients test positive, which is unlikely.
And sorry, my one follow-up question is, you were talking about these diagnostic kits.
Yeah.
Can you just get a little bit of detail as to how they're different and what exactly they are?
So the testing for this particular coronavirus, and we'll have to stop soon, I'm told, but the testing for this particular is specific, and so the CDC so far has had the specific testing methodology, and they have held it. Now they're going to distribute it at specific labs that have the expertise in running these tests.
Yes. So it's a novel coronavirus, so none of our standard tests for viruses, including human coronaviruses, are positive for this. And so the World Health Organization, CDC, got the sequences of this virus from Wuhan, and they've put together a test that will specifically pick up the novel coronavirus. And those are the kits that we're hoping to get very soon.
Which would help with diagnosis.
Yes.
Yeah, which will permit.
One night, do you guys have any idea how long they're going to be at both hospitals for?
As we said, the key is ruling them out. If they're ruled out and they remain stable as they are, they will go back to Miramar to complete the quarantine. If they're ruled in, then we will basically follow instructions.
Yeah.
We have time for one more question, and then we're going to wrap it up. Thank you. If they do turn out to test positive for the coronavirus, how will this impact the quarantine of the people who've already started their 14-day quarantine?
It won't. It's 14 days since travel.
So, and these people were like taken off the plane and brought over. So even if the people that are in the hospital were beginning to be contagious in the plane, that 14 days starts from when they land, so they wouldn't extend something beyond the 14 days.
Thank you so much.
Thank
for
you.
coming. Thank you.
Thank you very much for getting this
Thank you, yes.
story out and reassuring people.
Yes.
We really appreciate it.
Thank you. Why do they do it where there's...
Wet and
I-
soggy. I
No, it's my heels go down.
It's just a